the next. Let's welcome Mr. Abdullahi Aborode. He is a PhD student in Department of Chemistry, Mississippi State University, USA. He has a diploma in addiction medicine and addiction care and nursing from University of British Columbia, Vancouver. Abdullahi has a special interest in global public health, quality education and development issues affecting the global south and beyond, which are in view of the Sustainable Development Goals. Yeah, Mr. Abdullah, it's your floor.
All right, thank you, everyone. I really appreciate being here. My name is Abdullah. I just even wake up, so kind of good. So, Mani, I would love to talk about healthcare cost and debt and how it creates a gap in achieving universal health coverage. So before I can go in deep rather, I would love to expatiate more on healthcare debt and healthcare cost. Yeah. Basically, in low-income country, I'll take it one after the other. Depends on the continent and the environment that surround the situation. In low-income country, healthcare cost and healthcare debt, it's one of the most a significant burden to a lot of people to have access to healthcare, and also it's a big burden to them to get quality help. And yet, a lot of people are either in debt in order to get healthcare, or they are in serious healthcare alignment because they are unable to secure proper healthcare. But in middle income country, there is higher chances that there are a lot of quality and open space healthcare service, but the available healthcare is not sufficient enough, or is not really great enough for them to have the proper or quality healthcare they should have. So the one that I have is just in random or basic healthcare that they can easily have access, maybe headache, malaria, and most available or sponsored or funded project to certain or specific disease that they feel like it has to be open for all. But when it comes to private treatment, it's way expensive because the standard of living a lot of people over there, it is so in a reduced form that they cannot afford, treatment being in hospital for 3 to 4 days. Yeah, I come from Nigeria, and Nigeria is part or to be classified as a middle income country, and one of the subjective way and one of the crazy burden that a lot of people have is having first accessibility to healthcare. Before you have accessibility to healthcare, even if it is a governmental hospital, you have to pay. Then after you pay, the doctor will diagnose you outside before you have access to the healthcare. Then he will tell you that these are the drugs you used to buy. These are the injections you need to buy. Then without buying it, they cannot admit you normally to the healthcare as an inpatient, yes. So they cannot admit you as an inpatient. So without having all those things, because what they need to tell you is that the government part or the government funding is for you to be an inpatient, to sit on the bed for free. But any other thing, even to the patient clinic, you will need to buy it. So this is a big situation that surround, or a part of the situation that surround healthcare. Why a lot of people die on spot without getting the health delivery they should have. Why some people have to go home and keep managing without health till they die. So, and I'll come back to that. This is one of the whole situation, middle income and low income country. unaccountable for unknown disease. People just die without proper diagnosis of what actually make them or what actually kill them. Then the last part is high income country. I happen to be one of the highly standard income country during my PhD year. And one of the noticed things I noticed about healthcare cost and debt is health is extremely expensive. I say extremely expensive, even the healthcare insurance, as we insure ourselves for proper healthcare. Sometimes school pay part of your healthcare, while sometimes school we will tell you as part of your responsibility to pay for your healthcare insurance. So the question is, if I'm sick or what type of any unforeseen contingency of sickness that happened to me, can this insurance pay for my healthcare, healthcare alignment and healthcare situation? Absolutely, it depends on the healthcare, depends on what you are facing, the type of disease that you are having. So now we have to break things up. What is the value of healthcare insurance? We're trying to insure our health just for, you know, just for when we'll be able to have access to healthcare. Maybe we are having disease or you feel like you have to do a proper checkup for healthcare, for our health. But when we have the unforeseen contingency issue, do we have to go extremely uh, from our pocket because the insurance could not cover part of what we are facing as a challenge in our health? Then why are we insuring our health at first place? So the system, the whole system has been built around uh, a, a sphere whereby before you can have access to healthcare, basically, be it low income, be it middle income, be it high income country, you have to have money. Money is the open key to have accessibility to healthcare. Now, a lot of people will be concerned about, universal health coverage, which is Sustainable Development Goal 3, which is quality health, and United Nations has been keep on tab on it that health is for all, and yeah, health is for all. Then accessibility of health is for all, but they forget that quality health and outstanding health are for people that are extremely rich. Because I will make an example. I'm just having an headache. I'm trying to get a paracetamol. I'm just getting a paracetamol. I did just two tests, EKG and blood test. And at the end of the day, I collect my bills. I was having a $500 bills for just that. Absolutely, if I'm from my own country, just that could not cost me at least 3 to 4 thousand naira for my own country. Well, if I'm to justify that, okay, $500 to naira, that is a very big amount of money. So the question is that there are differences in continent at especially low income and medium income country to high income country when it comes to healthcare debt. Because as at yesterday, I was talking to some people when I'm trying to do some rough work for this topic, and I could see some families, some families are still in huge debt just because of health. Yeah, because they have treatment, access to treatment of health. They keep paying the money. And not like you're paying the money, taxes is adding to the money, and the money keep growing. So in short, healthcare cost, it's one of the factors that result to healthcare debt because people cannot afford to pay the high intense money of the cost that comes with healthcare delivery. Then it turns to debt. Now it goes around, it goes around, it goes around till it reach another generation that keep paying it. Now, how do we address this? No, these are the challenges that we are having that healthcare cost is extremely high. It is extremely high. People cannot have access to healthcare delivery. People are shocked because they feel like it is expensive. Then they change to a local way. Yeah, that is another factor. They change to a local way because they feel like local healthcare delivery is accessible. They can get healthcare delivery uh, in in credit. Yes, they can get healthcare delivery in credit. That credit, whenever they have time or they have money to be paying it, they pay it without being put on constraint. Then they feel like, or they get more trust in, let me say, local healthcare delivery, which people might call traditional healthcare, or they might call them, regional healthcare. They are just like herbal healthcare or medicinal healthcare. They are not professional doctors. They are not professional healthcare. They just know uh, how to utilize medicinal herbs, yeah, to treat different kind of disease. So now, when people go to a normal hospital, I feel like, oh, we are having malaria, and to get malaria, you have to have at least maybe maybe 4,000, 4,000 naira, or in high income country, you have to have at least like uh $2,000 or £1,500. Now, and there is a high chances that uh in um in a local region or a traditional region, there is a medicinal professionals that can actually solve that solution of malaria on a basis of at which it can be in a reduced form, a threefold reduced form, like 500 naira, or yeah, in a threefold reduced form, and uh, they will not place a priority on them that if you don't have the money or you don't pay the money, we are not going to get you treated. Yes. So people then, these are the system at which people create a system that surround these medicinal or traditional herb uh, doctors, or yeah, doctors, because they are not healthcare professionals. So they believe that whatever they give them, they get to heal faster because it's medicinal, it's traditional, it heals faster. But what about the implications of the lead compounds are present in these medicinal herbs? That is also a concern. So, and whereas there are some illness that cannot be treated in this type of setting, that need a secondary target. So, what is their situation? A lot of people die without even knowing that this is the cause of their death, because they feel like they are an household that their income per month is not even up to 1,000, and they go to a large setting, a secondary setting, and they say they should be bringing about 15,000 naira or $15,000. That is a huge burden. They will be left with no choice than to be managing or secure another alternative of options. And whereas the options sometimes save a lot of people life, but not all the time, because a situation like this is a big burden. In Nigeria or in some other African country or here, when we have illness that are highly costly, and that can create a lot of debt, people secure for medical assistance. You know, they beg for people to donate so as to secure healthcare. Then the condition would be like, or the question would be like, why do you have healthcare system that cannot provide for their people? Then why do we keep shouting universal health coverage when people are highly in debt, or people are they feel costly to buy or to have access to healthcare? This is one of the major big problems that is facing universal health coverage. And with I think that it happens all around the world, different country to country and country to country. Then the parties, the solution, the way forward. The way forward is to subsidize and reduce the leverage that comes with healthcare delivery. When people subsidize and reduce leverage that comes with healthcare delivery, number one, they will enact trust to the healthcare delivery, to the healthcare professionals, than going to herbals or traditional medicinals just to secure healthcare at a very low price or a very low cost, because they know that they can secure it and at the same time it can heal them. So why going to a place whereby they can secure health at the same time and it will heal them also at the same time? So they believe that one is more costly, but one is more in a reduced cost than the other one. So they explore the options because the state and the state of standard of income and standard of living of people will justify how they are going to secure proper health care. So one of the factors is the government should come in place to subsidize the rate at which the people charge healthcare costs. Not only subsidize their own governmental hospitals and other healthcare centers and facilities. And also, it is very mandatory to subsidize the rate at which private hospitals, yeah, or private centers or facilities, you know. Basically, this is what I have. I believe that reducing healthcare cost and giving health to all will reduce healthcare debt that a lot of people are facing all around the world. Thank you. If you have any question.
Thank you. Thank you. You are a PhD student and you have long way to go. And I'm sure you are still learning, and a lot of problems you think are there will be sorted out while you go on in your journey of understanding how the healthcare cost can be decreased, because it's not an easy thing. Even in the United States of America or even in the developed world, the cost of healthcare is very high, and everybody thinks in every country, how do we reduce the cost? And that is why we can go round and round and we can keep on speaking for hours. But the first thing is to prevent the issues that you have. Second, do believe in alternative medicine. That is the herbs and the medicines that you spoke about. There definitely a lot of research needs to be done because they do a lot of benefit to the people rather than harm. So you have to be very careful about when you make statements, because it's not that other medicines that are available in allopathy do not have side effects, or even if they are subsidized, they are going to be the best for them for long-term solutions. So therefore, prevention is the best medicine. And secondly, the alternative medicine, whichever is available, should be worked on, and then you can standardize them. I think now you've reached a stage in life where everybody is promoting alternative medicine, because everybody does not get benefit from for a medicine that is promoted in allopathy. So all the alternative medicines, whether it's homeopathy, whether it's herbal, whether it's Ayurveda, whether it's something that is used in Africa and doesn't have a name, they all are important. It's just that we haven't explored them enough. So since you are a PhD student, so I'm giving you a different perspective, so that when you go back from here and you start thinking, should we focus too much on subsidizing, or should we spend more time in standardizing the local solutions and what people can be happy and healthy with? So thank you very much for your time, and be in touch with us for any other question that you may have with us. Thank you. Thank you, Abdullah.
All right, thank you. Yeah.
Thank you. Bye-bye.